What's up, guys? We have an abdominal pain assessment. Kimberly's going to be our team lead. Dan is going to be our partner. Marshall in the corner is going to be our proctor. Diane is going to be our sick patient. Thanks, Diane. And then Danny Herman is going to be her dad. Okay, here we go. So, Marshall, can you paint us the scenario?
Yes. You are dispatched to the residence for abdominal pain.
Okay. I have my BSI on. Is my scene safe?
Yes.
Okay. How many patients do I have?
Just the one.
Okay. And then I would like to consider ALS. I don't think I need them right now, but are they available if I do?
They're unavailable.
Okay. And then, what's that last one?
Sick?
No, it's not that one, but okay. I'm gonna approach the scene. This is a nature of illness, and it appears to be, well, I don't know yet, but when I walk on scene, it appears to be somewhat abdominal because she is guarding a little bit. She's protecting her abdomen. So hi, my name's Kimberly. I'm with UIC EMS. This is my partner, Dan. What seems to be the problem today?
Yeah, my lower abdomen, kind of like on the right side. I'm a little bit of my belly, but it really hurts.
Okay. All right. So chief complaint is the lower right abdomen is in pain. What is your name?
Diane.
Diane. How old are you?
I'm 16. I'm 16.
I have a 16-year-old female patient, and then this appears to be medical, not trauma. You didn't experience any falls or trauma or any pain to your neck, back, anything like that,
No,
your head?
nothing.
Okay, so I'm not going to consider spinal stabilization. I don't think it's necessary here. And then can you answer a couple questions for me?
Yeah.
Okay, so you told me your name. So where are we right now?
I'm in my house. My dad's here.
Okay, so, and then what's today's date? Or
Thursday. You need the exact date?
no, just what day of the week is it?
Oh, a Thursday.
Okay, and then do you know who the current president of the United States is?
Yeah, my man Joe Biden.
Correct. So this patient is ANO times 4, and she does look sick because she is in that guarded position. All right. So the airway appears to be clear. She is speaking to me, so that's how I know there's nothing obstructing that. I don't hear any stride or anything, do I?
No.
Okay. Moving on to breathing. How's my patient's tidal volume?
It's adequate.
Okay. What about relative rate and pattern?
Rate is a little quick, but the pattern is normal.
Okay.
Yeah.
So it's fast. Okay. And do I see any accessory muscle use?
No.
Okay. How is her pulse ox?
Pulse ox is 96%.
Okay. So right now I don't see a need for oxygen.
Okay.
Do you agree?
What was that pulse ox again?
Wait. Her
like
pulse
to
ox is 88%.
Oh,
Okay.
okay. In
Yeah.
that case, then I think, Dan, would you go ahead and assemble a non-rebreather mask at 15 liters per minute for the
Okay.
patient?
Do we think they're in respiratory distress then?
I do. I think with the low pulse ox, and she is breathing a little bit fast. So, Diane, we're going to give you some oxygen. That should kind of help you feel a little bit better, okay? And then once that's set up,
I feel like I'm in a movie. This has never happened before.
Is this gonna help my daughter?
yes, this is going to help her breathe better. Okay? All right. So he's going to set that up.
Okay. We're gonna put this over your head, and then you're gonna have it right on your face there, okay?
Okay. And then, Dan, could you also assess the patient's lung sounds for me?
Sure, so we're going to check our lung sounds on both sides. So we're going to compare the left and the right side. So first I'm going to take mid-clavicular, so in the middle of our clavicles, we're going to drop down a little bit. We'll take one here, then we're going to go below our nipple line here. We're going to take one here, and then we're going to go mid-axillary and take one here and here, okay? And what's our lung sounds?
Lung sounds are clear.
Okay, perfect. So anything else before we move on to circulation?
I think we're good to go to circulation.
Okay. So do we see any bleeding?
No, you don't see any.
Okay. And then what are my patient's skin conditions?
Pale, cool, diaphoretic.
Okay, because the patient is pale, cool, and diaphoretic, to me that seems like this patient might be in shock, again with the low SpO2 and the guarding of the abdomen. So I'm going to state that she is in shock.
Okay.
And then we are going to also load and go, and I'm going to lay her flat, supine,
Sure.
and I'm going to provide her a blanket. We've already got that oxygen therapy, and that should cover shock treatment.
How about we check out that pulse too?
Yeah, I'm getting there. And then I'm going to assess the patient's pulse. So I'm going to check on the radial side right here. I'm going to check for the strength.
It is weak.
Okay. I'm going to check for the regularity.
Regular.
And I'm going to check for the rate.
It's tacky.
Okay, so
Right.
fast. And then I'm going to check both of them to see if they're equal.
They're equal.
Okay. So they're
And then what was the
They're-
strength again?
Weak.
It was weak.
Oh, it's weak, okay.
Weak and tacky. And then the last thing I'm going to do is I'm going to assess capillary refill. So I'm going to take the finger and I'm going to hold it, and it should turn a white color. And then how fast that color restores to normal should tell us. If it's less than 2 seconds, that's normal. If it's not, well, we're going to keep an eye out.
It's more than 2 seconds.
It's more than 2 seconds. Okay.
What's going on with my daughter? Is she gonna be okay?
So we're just doing an assessment, sir. So the oxygen should help. What's our current SpO2?
It's going up now. It's like
Okay,
92.
so the oxygen's helping her, but we're just going to continue our assessment and see what we can do to help her, okay?
Alright.
Come on, Dad, calm down.
Okay. Anything else, Dad?
And I missed it. Did we have accessory muscle use?
No.
Okay.
All right. In that case, I'm going to go ahead and go into my secondary for abdominal. So are you experiencing any weakness, shortness of breath, or chest pain?
It's a little hard to breathe, but this is kind of helping.
Okay.
I do feel not really weak, but like pain. I guess I like it pains a lot in this area.
You're in a lot of pain?
Yeah.
Okay. And then are you experiencing any nausea?
Yeah, I am.
Okay. And then have you vomited at all?
No.
Okay. So we can skip the hematemesis or coffee ground emesis questions because there's no vomit. How has your stools been? Have you noticed any abnormalities in your stools?
My stool?
I'm sorry, your poop.
Oh, okay. They look the same.
There's no like dark tarry color or any bright red.
I don't really stare at it, but no, I didn't notice it.
Okay. And then have they been pretty regular as well, or have you noticed that you're either constipated or diarrhea?
No, they've been regular.
Okay.
My dad makes me eat one whole batch of celery each day.
Good for you,
It's a
Dad.
healthy
disgusting.
just to the diet.
It's good for you. He's keeping you young. And then we're gonna listen to the bowel sounds. Dan, could you do that for me?
Sure. Okay, so we're gonna go on our stomach and we can listen in each region with our stethoscope here. Okay?
They're normal.
Okay, normal bowel sounds. Awesome. And then I'm going to have you lift up your shirt. We're going to look at just your stomach, okay? We're going to look for any distension or discoloration.
No distension or discoloration.
No? Okay, we're going to look for any visible swelling or masses.
Not that you see.
Okay, any open injuries?
No.
Okay. Anything else?
How
Before
about we
palpate?
could palpate, yeah.
Okay. And then we're going to palpate. Dan, could you do that for me?
Sure.
But we're going to look for any rebound tenderness, any
So you said it's hurting on the lower right side, correct?
Yeah, it's like near my belly button too.
Okay, so I'm gonna start over here. Okay, I'm gonna try over here, and then now over here. Okay, so mostly on that lower right side?
so it's tender to the
Okay.
lower right.
Yeah.
Did you feel any masses?
I didn't feel any masses.
Okay. And then any rigidity or anything?
The right side seemed a little rigid. But
Rigid. Okay. Anything else we want to check for in the abdomen before we move on to the questions?
Let's see. I don't think so.
Okay. I'm going to ask you a couple questions just because you're female assigned at birth, correct?
Yes.
Okay. So, when
Females rule the world.
when was your last menstrual period? Do you know?
Yeah, it was like 7 weeks ago, I guess.
Okay.
7 weeks.
Yeah.
All right, Dad. It's just the routine question. That doesn't mean anything. Maybe something's going on. We really don't know what's going on.
I mean, it's kind of like regular. It's been like in the past I've missed a couple of periods.
Okay,
here
so
and
the
there.
history is missed.
Yeah, but it has been like a little over 2 months now.
Okay.
Almost 2 months.
Is there a possibility you could be pregnant?
No, there's not. Not my daughter.
Okay,
Why?
say. Could we have her answer for yourself?
I do have a partner.
Okay.
What?
We
Okay, you
Under
know what?
my roof?
You know what? It's okay. We'll ask you the rest of We'll ask you that again in the ambulance.
Oh, okay.
We'll separate. Yeah. And then
Kids.
Damn, calm down. It's like the age these days.
Discharge.
any
Discharge.
unusual vaginal
Can't
discharge?
talk.
Yeah, I did. It's I've had some bleeding,
Okay.
and it has been persisting today.
That could very well be why you're lightheaded. Okay. But you notice it's different from
It's
your
different
usual.
from my usual period.
Okay. Anything else?
So,
Okay. I'm gonna go back into the history. So when did this pain start? Was it really, really sudden, or was it more gradual?
It was really sudden.
Okay. And then, does anything make it better?
No, I just feel worse and worse, and I'm getting more lightheaded.
Is there anything in particular that makes it worse, like getting up or exertion or anything?
No, it's just
No.
I feel
Okay.
worse.
And then, how would you describe this pain to me? Like, what does it feel like?
I don't know, but like someone punched me really hard, and it just hurts in my abdomen a lot.
Okay.
I get really dizzy.
I'm really sorry. We're gonna get you help, okay? And does it go anywhere, or is it just your stomach?
Yeah, it's like
It's just there. It's
yeah.
localized. Okay. And then on a scale of 1 to 10, 1 being it doesn't bother you at all, and 10 worst pain you've ever felt, how would you rate that?
It's like a 9.
Alright. Is that oxygen helping you?
Yeah, it's easy to breathe.
Okay, good. And then when did this start hurting? When was the first time you noticed it hurting?
I've noticed it bleeding for a couple of hours now. It's been like it started really hurting like maybe 2 hours ago.
Okay. And then do you have any allergies?
No.
Are you on any medications we should know about?
No.
Okay. And then, do you have any past medical history we should know about?
No, bro, I'm only 16.
No. Okay. Are you
never been pregnant before you did?
No, I haven't.
No.
Hope not.
Okay. All right. And then, what was the last thing you had to eat or drink?
I think I had like a block of celery.
A whole block. Got it.
Yeah.
All right. And then, what were you doing before you started experiencing this pain?
It just came on like super suddenly. I think I was maybe watching TV.
Okay. Is there anything else, any additional symptoms we should know about? I know you said you were lightheaded and a little short of breath.
No. I feel nauseous as
Nauseous.
well. And it like hurts basically only on one side.
Okay. All right. Anything else before we grab a set of vitals?
No, I think we can move on to vitals.
Okay. I'm just gonna take some vitals. So can I have a blood pressure?
Yes, 98/60.
Okay. And our current SpO2?
It is 94 now.
94%. Good. So the oxygen is helping you. That's a good sign. And then a blood glucose. Dan, could you actually demonstrate how to do that?
Sure.
Or actually.
Okay,
yeah.
well, we're just going to use our glucometer. We're going to stick our patient's finger and we're going to grab our glucose. So what's our glucose level?
You got a 73.
Sure.
73. A heart rate?
110.
110, so still tacky, and a rest rate.
21.
21.
Yeah.
Okay. All right. So we are going to take you to the hospital. So we already made that transport decision, but we're gonna take you. They should be able to help further diagnose what's going on. Okay.
Am I with my dad or just me?
Can I come with you guys?
Actually, due to the COVID-19 regulations, they probably won't let you stay. So it's probably best if you drive separately in your own car.
I'm gonna follow right behind you guys.
Well, as long as you don't go through the stoplights with us.
Whatever.
Thank you, sir. And then, so we're gonna reassess you every 5 minutes because she is in shock, likely hemorrhagic shock. And then we are going to repeat the primary assessment, repeat any relevant vital signs. We're gonna check her interventions. So her SpO2 level did rise after the administration of the 15 liters of oxygen. And then,
Sort of field impression.
yeah. So our field depression is ectopic pregnancy, because we did have that rigidity, and it was 7 weeks, so it is possible. And
Since we're not with
a lot of
Dad anymore, maybe we can ask some of those questions again.
Yeah. So I know that answers change when you're in front of your parents. So
Yeah.
now that he's gone, is there a chance you could be pregnant?
Yeah, it's possible. Me and TJ, we did it a couple of weeks ago. Like, I guess around the same time.
Okay. Well, it's possible that, something could be a complication or, so we're going to take you to the hospital for further diagnosis, okay?
Okay.
Okay, so I think that supports our field impression
sure.
of ectopic pregnancy.
For sure. I was going to say something else and I forgot. And how are you doing now?
It feels worse. I still feel more
It feels
lightheaded
worse.
and
Okay.
nauseous, yeah.
All right. Well, we're only a few minutes away from the hospital, okay? All right. Anything else for...
Okay. And you don't think you're pregnant, so you're not doing any prenatal care or anything like that, right?
No, I don't even know.
Okay, that's all right.
TJ said he pulled out.
Okay.
All right. And then... Ready to report?
Yep, I think so.
All right, so Northwestern, this is UIC Rig 1. We're incoming with a 16-year-old female complaining of pain to the lower right abdomen. We found some rigidity and tenderness to the lower right quadrant. She has some nausea. She is lightheaded. She has some shortness of breath. Her initial SpO2 was 88%. It's currently reading at 94 after 15 liters of oxygen via a non-rebreather mask. She does have a weak and tachy pulse. And then she thinks it's a possibility she could be pregnant. Her last menstrual period was 7 weeks ago. The pain was sudden, but she's been experiencing some vaginal bleeding for approximately 2 hours. And then her current set of vitals are a blood pressure of 98/60, a pulse ox of 94%, a DEXY of 73 milligrams per deciliter, a pulse rate of 110, and then a resp rate of 21. We are approximately 5 minutes away. Do you have any other questions or orders?
Nope.
All right, see you in 5.
Awesome job, Kimberly.